Welcome, everybody, to our interview. I'm the chair of the Communication Committee, for those of you who don't know me, from the International Society of Hypertension, and it gives me great pleasure to be joined here by my colleagues. I'd like to introduce Professor Fadi Charchar, Dr. Priscilla Prestes, and Professor Swapnil Hiremath. Fadi, do you mind if I call you Fadi for the rest of the interview? Do you want to introduce yourself?
No, that's fine. Yeah, my name is Fadi Charchar, and I am the director at the Health Innovation Transformation Center at Federation University, and I'm also the treasurer of the International Society of Hypertension.
Thank you. Priscilla.
Hi, my name is Priscilla. I'm a research fellow at the Health Innovation and Transformation Center at Federation University Australia in Ballarat. I'm a former member of the College of Experts of the International Society of Hypertension.
Swapnil?
Hey, I'm Swapnil Hiremath. I'm a nephrologist, epidemiologist at the University of Ottawa in Canada. Today I'm wearing two hats because I am a member of the ISH Communications Committee that Anastasia leads. And I'm also one of the contributors to this, the position statement that was led by Priscilla and Fadi that we are going to talk about today.
Thank you. Yes, I should have said that at the beginning. We're privileged to have the two lead authors and drivers for this position statement. Thank you for making the time. We might start with the questions, and what we'll do is we'll alternate between Fadi and Priscilla and between Swapnil and myself. So I'll start with the first question, Fadi. Could you provide us insight into why ISH decided to have a dedicated position paper on lifestyle management of hypertension? And how does this position paper add to the existing International Society of Hypertension guidelines on blood pressure management?
I think I don't need to speak for the paper itself, but the importance of lifestyle modification is clear, and there is a huge need of understanding what lifestyle modifications we need to improve our blood pressure and to prevent a high blood pressure. So the society, got together and decided to have a think of what topics that are missing in the literature. Really, there's no specific position papers or even proper guidelines into these. Lifestyles often included in the big guidelines, the ESH, the AHA, the European Cytopsychology guidelines, our guidelines, ISH. They've all got a little bit on lifestyle, but there hasn't been really a paper that's been focused on lifestyle itself per se and expanded on the topics. And we also understand there's a lot of changes happening. There's a lot of things going on in that field. There's a huge interest in prevention and lifestyle changes for blood pressure. So I think that's why we chose that topic in particular. And obviously because of interest from me and Priscilla and all the other authors that came on board on this publication. And I think the point of difference for this position paper for the ISH is that we took a really international perspective, and we wanted a sort of recommendations linked to implementations, not just recommendations, like, to give the individuals, the clinicians, ways to look at the recommendation, but how also do we implement it and what's missing in the field. And I think this is just probably a start into digging into the lifestyle prevention modalities.
Thank you.
Yeah, thank you. Yeah, so Priscilla, just sort of moving on along the same path. So there are most hypertension guidelines you see, for example, the ISH or even our own ISH guidelines, they focus on a few things, like diet, sodium or potassium, or maybe on exercise or weight loss. These guidelines cover a much, much wider swath of topics for lifestyle change and lifestyle management. Do you want to give our viewers a little bit of a brief overview of the things that, perhaps are ignored or less well publicized that this position statement brings to the fore?
Yes, so following on from what Fadi was saying, that we have some details on guidelines here, there, and everywhere. We wanted to have a comprehensive and include many or all that we could find that were relevant guidelines that had background and had actual scientific evidence for them. So we used a very simple language to make it accessible for healthcare practitioners, but also the community, and very translatable. So, for instance, we added the most common, as you mentioned, Swapnil, that diet and weight loss, and some emerging fields. For instance, one of them is fiber, where we included the minimum amount of fiber that you should have in your diet to have benefits for the for heart health. And in there, we also have examples of how much fiber you might find in certain foods. We also included things like detailed information on amount of coffee or tea that someone might drink, and the emerging field of other drinks like beetroot and pomegranate juice and some cocoa drinks, and moving away from the established parts, which are diet and exercise. We also included other parts that included body and mind. So how much sleep, how to have a good sleep routine and sleep hygiene, include practices to reduce stress, like practice mindfulness, meditation or yoga, music, and we then linked all that with how to track and how to use digital technology that is very prevalent these days to our advantage, and how to use that to track your diet, your exercise, and some of mindfulness practices that are available out there.
Fantastic.
Priscilla, I'm going to not give you a rest and continue. We're fortunate that we have a global community in the International Society of Hypertension. Could you give us some insight on how you assembled such a great large group of experts?
Yeah, so that was an interesting task. As I mentioned, I was a part of the College of Experts, and we initially sent an email out to members asking who has expertise in these areas and would like to contribute to the paper, and where they think the expertise would better suited for the paper as well. And then we started getting responses and assembling the team and finding their strengths. So we always, I should say, got someone to work on their best area, their expertise. So we use that people's information on how they felt comfortable and where they could contribute the most. And after that, we had a few international meetings. We were trying to assemble people from all around the world, and a lot of emails back and forth, putting it all together and making sure that everybody had presented the best case for their area of expertise.
Congratulations to you and Fadi for doing such an immense job, because it's not easy, excuse me, let alone writing it, coordinating such a large group. Sorry, Fadi?
I know some of the people, Anastasia, came forward with their expertise, and some people we tapped on the shoulder because we know they're experts and they've published a lot in the field. So we wanted the best people that can contribute.
Okay, so excuse me, my voice. My question is, Swapnil, I'm going to take the privilege of being the chair. You were part of the writing group. I am surprised that your section expertise is alcohol. And do you want to just give us a little bit of a glimpse, not just to tease our readers about the section? And can we still have a glass of wine with our meals? Because I know that that's been a very contentious issue for other cardiovascular disease.
Yeah. So I'm going to be the party pooper here to say, there's no safe lower limit these days, right? So we have pretty good evidence. If you look at the whole cardiovascular literature, and this could be the topic of an entire hour, which I'll not go too much into that. But the whole moderate drinking stuff is a lot of observational data which is pretty strongly confounded. If you look at RCTs, what we cited is the fact that if you look at trial evidence, reducing alcohol intake does reduce blood pressure. And especially the other important thing is binge drinking is also associated with high blood pressure. So it's not just the regular moderate drinking, but even binge drinking is associated with badness. So that's the I'm afraid I'm the bearer of bad news, saying if you want to get your blood pressure down, drink less. I found out again looking at the global, right? We were looking at global worldwide consumption. Canadians drink less alcohol than Australians. So I was writing the.
It must be the weather.
Just a little bit.
I'm pretty sure of that. We've got a reputation for a lot of alcohol drinking. I think Fadi and Priscilla would agree. Because
though it seems so Europeans of course drink way more, and Czech Republic, Czechia is the leader if you look at alcohol intake per capita, which I did not know until now. But moving beyond alcohol, I was the interviewee. Now I'll be the interviewer again, wearing that hat. If I can ask Fadi, this position statement has been endorsed by the World Hypertension League and by the European Society of Hypertension. What do you think these endorsements, will they help, or how do you think about these endorsements in terms of implementation of these lifestyle changes?
Look, I think it's important to involve the peak bodies in hypertension, from different parts of the world, and obviously the WHO and the ESH are one of the two peak bodies, and we wanted to involve. And it's part of our global mission, I guess, to involve people from across the world and people who contribute to different societies and so forth. I think it's great. Yeah, absolutely. That they're endorsed the position paper for us, because it brings us to a larger audience and to, I guess, larger acceptance across the globe per se.
I might ask both of you for your viewpoint. How do you think ISH is going to ensure implementation of these recommendations from your position paper? Fadi first, and then Priscilla.
Look, it's a tough question, obviously, but we're not stopping here by just writing position papers. We want to move forward, and our next step, obviously, within the society, is to empower the patients. That's one of our mission. And our current president, Brian Williams, it's his want to do. So our next bit will be to write simpler version even for the individual, for the patient, for the person on the street. And it might be in different languages, and it might be in different, different kind of diet talk. People in Asia don't eat necessarily exactly the same in Africa as in the US, as in Canada. So I think we'd like to take it forward, and I certainly want to take that forward and do that kind of across the globe translation. And we're obviously always talking to the different peak bodies across the world, the WHO, the WHL, trying to make sure there is implementation, there is sort of that the message goes across, not just to our members. We want it to go across the world, right? And to in different people and different individuals in different countries.
Thank you. Priscilla.
I think dissemination of the information is very important as well. So things like this that we are doing now with interviews, that it's going to be easily available for anyone to access, is very important, because it gives people the opportunity to get the information in an even simpler way. I think another thing that we try to do with the paper is to condense all the information that we had in the paper in the one central figure that can then be used whichever way people might want. So, a healthcare practitioner might have it in their office for someone to take home, to get that at least at the start of the conversation, and make sure that people take ownership as well of their health, with the support of the healthcare practitioner, and making sure that we get we don't stay in the scientific world, but we get down to a lot of, the community, as Fadi was saying. I think that's a very important thing to aid implementation and ensuring that it gets to the people who need it as well.
Thank you. So on that note, I'm going to go around with your last take-home messages that you would like our viewers and also the readers of our guidelines or position statement to take from this immense effort from all of you and all of your writing group. Fadi, as one of the leads, would you like to say a few words?
First of all, I'd like to thank all the people that contributed to this paper. And it's been a lot of work and it's some arguments, because obviously some areas are not black and white, right? And there's still going to be lots of changes. This is going to be an evolving document. So I like our readers to, actually disseminate the paper, read it. If they think there's things in there that, that are not right, write to us, talk to us. We need to keep this alive. And it's not just about one document that gets published in 2023 and for the rest of, the next 5 years. I think this is going to keep changing and evolving per se. So hopefully, we've started the conversation and try to push forward in your primary healthcare. I think it's really important that in terms of prevention, and even if people are on treatment who are not reaching their target, this is a fantastic way, to, help, reduce your blood pressure even further.
Thank you. Priscilla, second lead, or co-lead, I should say.
I think, I would like to see people taking a holistic approach to lifestyle changes and not only focusing on one thing or another. I think it's very important to take into consideration where the pitfalls might be in your lifestyle so you can achieve a better outcome.
Thank you. Swapnil, you get to say your
point
of view from the other end.
So a couple of things. One is I would, sincerely like to thank Priscilla and Fadi for packaging this together. This was a huge undertaking. They are being very modest, but the contributors did their own thing. But packaging all the pieces together and going through all the feedback and making this into this really useful document it was a fabulous undertaking which they have carried off very nicely. Secondly, I think in terms of the utility of this, the first question when you have a patient whose blood pressure is high is, doctor, I don't want to take another pill. Is there something else I can do? So this is a very useful resource, right? And it's not just on salt, eat less salt, which is what typically we would do. There is like this, as Priscilla pointed out, there are all these things that could be done. And maybe one thing will not work for a patient, but something else will from this huge amount of lifestyle changes that we have put together. It's kind of like a very useful, people think of guidelines as this, person saying, 1A guidance, you must do this. This is more like a helpful resource, right? A guidance for people, for the patients as well as for us, saying, look at this. These are the things that may help. Pick and choose what will work for your patient.
Can I just add, Anastasia? It's
yes,
all
sure.
One thing we really concentrated on in this paper is behavior change, because part of these lifestyle changes, and we all know how difficult it is to do this, and that will be also more. We need to think of ways to change our behavior, and we talked about the digital aids, the watches that we wear that can tell us what our heart rate, what not blood pressure yet, but that might be coming, but all these things that help change our lifestyle, our behavior. And that's really important.
I think that's the important point. Swapnil pointed it out, and Priscilla and you pointed out that it's not just for practitioners, it's for people. No. We have lifestyle as the first recommendation across all guidelines. Right. But when we see patients, and I see that, and you all see that, they ask for lifestyle, and we do it each day. But the trouble is that the difficulty is they get bombarded with different information, so it gets confusing. It's good to have this information. On the digital front, we had discussion at the recent European Society of Cardiology meeting and other meetings. patients lose interest. So it's about engagement, not just for patients, for all of us. And this starts the conversation. So I thank you as leads and your whole writing group for putting this together. And we look forward to much continued discussion, and also from a few, I shouldn't say each because it was a large group, a few of the writing group highlighting some of the key points. But we, as Fadi said, we will continue this conversation. Thank you, everybody.
Thank you, Anastasia and Swapnil. Thank you.
Thank you.